The physicochemical characteristics of the medication, the route of administration, and the precise site of absorption are only a few of the variables that affect the process of drug absorption. Here is a general overview of how drugs are absorbed. Drugs diffuse through biological membranes from an area of higher concentration to an area of lower concentration in a process known as passive diffusion, which accounts for the majority of drug absorption. This happens along a gradient of concentration, and requires neither the body nor the medicine to expend any energy. The drug's lipophilicity, ability to dissolve in lipids, molecular size, and the physicochemical characteristics of the biological membrane, such as its thickness and surface area, all affect passive diffusion. Facilitated diffusion. This method of medication absorption involves the passage of pharmaceuticals through a biological membrane with the aid of particular carrier proteins. Even though it can happen in the face of a concentration gradient, facilitated diffusion is not energy intensive for either the organism or the medication. Drugs that are structurally similar to endogenous chemicals that are commonly carried across cell membranes are usually treated using this approach. Active transport. To move pharmaceuticals through biological membranes against a concentration gradient, active transport requires the organism or the medication to expend energy. Specialized carrier proteins that actively pump medicines across the membrane are used in this technique. Although less frequent than passive or facilitated diffusion, active transport has the potential to be a significant route for some medications, particularly in certain tissues or organs. Endocytosis/exocytosis. Some medications, especially those with bigger molecules or nanoparticles, may enter the body through either endocytosis or exocytosis. Exocytosis is the process by which cells release medications from vesicles into the extracellular space, whereas endocytosis is the process by which cells ingest drugs into vesicles and transport them inside the cell. Drugs that cannot easily pass cell membranes through diffusion or active transport are often administered using these techniques. Specialized transporters. Drugs may occasionally be absorbed through specialized transporters that are unique to particular tissues or organs. For instance, certain transporters play a part in the blood-brain barrier's regulation of drug entrance into the brain and the renal tubules' function in drug excretion. Overall, drug absorption is a complicated process that interacts between the physicochemical characteristics of the drug, the route of administration, and the precise site of absorption. Depending on the situation, it can happen through passive diffusion, facilitated diffusion,